Good evening, everyone. Thank you for joining us for Glaucoma Australia's live Q&A. My name is Sapna. I'm a patient educator at Glaucoma Australia. Joining us this evening, we have Scot Muirden, Director of Charles Bonnet Syndrome Foundation. Welcome to our live Q&A, Scot.
Thank you, Sapna.
Now, before I further introduce you and hand over to you, I'd like to mention a couple of things to our viewers who are watching this live and also to those watching the recording afterwards. Please keep in mind that having glaucoma does not mean that you will end up with Charles Bonnet Syndrome. This condition is not specific to glaucoma either, meaning it can happen to those with other eye conditions that can lead to some degree of vision loss. Tonight's session aims to provide information to those living with Charles Bonnet Syndrome, those supporting a loved one with the condition, health professionals looking for more support for their patients, and no doubt, viewers who have never heard of such condition but are interested in finding out a bit more. Scot has a degree in psychology and social work. After working in the field of psychiatry for a decade, he has spent the last 20 years in the field of vision loss. And we are very grateful to have him join us this evening to shed some light on Charles Bonnet Syndrome. Please feel free to send through your questions, which we can discuss with Scot towards the end of this session. Okay, so over to you.
Thank you, Sapna. So, thank you everyone who's logged on for this presentation. I hope you find it valuable and informative. I'm aware that it's going to be a condensed version, but we'll do our best with the time that we have at our disposal. I think I can start by saying that Charles Bonnet Syndrome is a truly fascinating condition, but it's terribly neglected, both in the medical and healthcare sectors. And because of this neglect, it's led to not very high quality information trickling down to service providers, clinicians, and then in turn to the general public. So it's actually led to a lot of misunderstandings about the condition. And I hope that some of those will be clarified in this short presentation. So why don't we dive straight into it, shall we?
Yeah, let's go ahead.
So as we all know, vision loss comes with, it's not just loss in itself, there are multiple levels of loss, and the loss of reading ability, the loss of a driver's license, the loss of self-esteem. There's those ripple effects that affect the person and their loved ones' community. But what is less well known is the fact that there's also the possibility that as a result of that vision loss, there's going to be an unexpected addition to the person's life. And that's what we're here today to talk about, this addition, which sometimes can be quite terrifying, not always, but it's important that people are aware that this is a valid and real clinical condition that we've known of for a very long time, as we're about to find out. And people need to be better acquainted with the syndrome. So, Sarah, next slide. So this is where it all begins. This is how far back we've known of the syndrome. 1759 in Geneva, Switzerland. And it began there very quickly. The story is that there was a natural scientist at the time living in Geneva called Charles Bonnet. And he was a natural scientist of international repute, and some of his findings and theories on a whole range of topics. Some of them are still being taught in universities today, but we're not going to discuss those tonight. What is important, though, is that around this time, he was in the process of writing a book on, he'd been in the field as a scientist for a good 20 plus years, and now he was moving into the area of religion, philosophy, and psychology. So it was on his mind that he was writing this book. And it was at this time that he went one day to visit his grandfather. And his grandfather on his maternal side. And this grandfather was now 89 years of age, and he was a retired magistrate. He had an excellent mind. Physically, he was in good health. The only problem was his vision was starting to fail him. He'd had a cataract removed in 53, and then he had another one removed in 1758. And even though he got some improvement in the vision after those cataracts being removed, now in 1759, he's finding that those gains have tended to dwindle away. And now when his grandson Bonnet visits him, he starts to tell him these absolutely miraculous stories, fantastical stories about visions he was having. Next slide. And in fact, it was so fantastical that he had to make a point, Bonnet, in his book 1 year later, that people would be very inclined to just dismiss it straight away because it just sounds, yeah, right, totally unbelievable. So let's get to, I'm now going to show a slide. Well, Sarah's going to show us a slide in a second, which is the biggest amount of print or text that we're going to have in this presentation. So I apologise for this, but for those who are unable to read the print, I'll read it out for you, because this really is the cornerstone or essence of the syndrome. So let's read it here. I know of a wise gentleman, that's his grandfather, of great reputation and in good health, whose memory is very good, and who now and again, while fully awake and without any external impression, sees images of men and women, birds, coaches, buildings, etc. The images can change size. They get closer or they move away from him. They appear or they disappear. Buildings in all detail would appear before his eyes. The images were perfect and would appear in the outside world as if present. The images were always silent. This man never accepted these images as real and took them for what they were. So there you have the cornerstone of the condition. He's actually outlined in 1760, and really pretty much most of that still applies today. So let's go on to, I think, yes, now we're going to see a few depictions, trying to give you an idea of the sorts of things that people can see, not just Bonnet, but people nowadays are experiencing. So this first one is actually of Bonnet, of Bonnet's grandfather. This is based on a true story. It's a graphic novel from a UK book that came out about 6 years ago by Gareth Brooks, and it's called 1,000 Coloured Castles. And the main character in that novel is a woman called Miriam, who's starting to experience vision loss and is also starting to have visions of her own. But this is one little bit from the book, which is based on that Bonnet story, or the grandfather story. So there he is on the first floor of his apartment, and he's looking out over the street to the neighbouring building. and he notices a horse and cart, a horse and carriage opposite that building. And to his utter astonishment, as was mentioned in that earlier text about things getting smaller or larger, in this case, he's blown away by the fact that the horse and carriage is slowly increasing in size till the carriage is really the same size as the building opposite him, and he's utterly blown away by what on earth is happening to me. So with this next slide, you'll see some other examples of what people are seeing in current times. Here we've got a person inside a room. They've got all this white, cloudy material that is blocking most of their visual field as a result of a particular eye disease. But in the areas where there is no of that white, cloudy material, the person is seeing these beautifully formed blue squares. The next one. Now, getting back to that novel that I mentioned, here's Miriam, and she's at the front of, she's peering out the front window of her house. She's prized away the curtains, and what on earth is she seeing? She's seeing two figures holding guns, and perhaps the most curious thing is that on their heads, they've got these most unusual upturned ladders on their heads. And Miriam is saying, "Leave me alone." The next slide. Now here's some scotoma, or black spots that have appeared in various parts of the visual field. Nothing can be seen behind them, unfortunately. And in the wash basin, much to the probable astonishment of the person, in that wash basin appears a figure. They've got a sort of golden skin complexion, and like the previous slide that Miriam was watching, this bizarre looking character has a very unusual headdress, and it needs to be pointed out that this is one of the really peculiar aspects of Charles Bonnet syndrome, that often when people see figures, they're not seen as everyday common figures that you would see in everyday life. And one of the peculiar features is if people do see figures, they've often got a hat on, or they've got some sort of bizarre headdress, as is illustrated by this slide and the one before. Okay, the next one. So here again is Miriam, and she's walking through a supermarket, and she's going through an aisle, and as she's walking through there, at the top of the supermarket shelves of that aisle, there are these plants that seem to be growing and swooping down on her, almost like something out of Day of the Triffids. The next one. Now, this is one that maybe people with glaucoma might be able to relate to a bit more, given that advanced glaucoma often robs a person of their peripheral or side vision, and they're often left with a more narrow band of vision that's sometimes referred to as tunnel vision. Here we have an instance where the black represents all the area where vision has been lost, but in that central area, there is this thatching of blue and red lines. So they're just some.
Scott. Sorry, I just wanted to bring it up. So since we do have an image there of what glaucoma can look like, we do have a question that's just come in from Abdul. I was wondering if you can help answer that one. So Abdul wanted to know if you have any statistics of of Charles Bonnet Syndrome developing in patients with glaucoma. And I understand, like we said at the beginning, it's not specific to glaucoma. So would you have any statistics around, you know, how many patients with low vision do end up with it?
Yeah, okay. Well, there is coming some statistics that are coming shortly, but I'm aware that they are generic and they apply. But what I can tell you right now, that when it comes to glaucoma, there have been a number of studies done and the figures vary. Sometimes the figures are around 8 or 9% of all people living with glaucoma who will develop this syndrome. But we find sometimes those figures go up to about 19%.
Wow. Okay.
But overall, as we'll find out in the statistics provided a bit later, it's quite a sizable proportion of people that we're talking about.
Okay. Thank you. Thank you. We do have another 15 minutes to go. Thank you.
Next slide. Okay, so when you've started to, if you've experienced anything remotely like the slides that have been presented or just the descriptions I've been giving for those who are not able to take in the slides, the central thing that tends to happen, the critical thing, is that the person who's experiencing it often they have no idea what on earth is happening to them, because too often no one in the eye health care community has ever forewarned them that this is something that may occur down the track, and no one has also inquired as to whether they are experiencing some unusual visual experiences. So because of the lack of information that a lot of people are being provided, then the person like that, I think the slide's coming up in a minute, but often then it's left to the individual on their own. They've got very little to go by and a whole flood of questions start to bombard them. And the first one is, is my mind really starting to unravel? Is this the start of dementia? And then another one is, do I have a brain tumor? Is there something seriously wrong in my brain? And then thirdly, am I losing my mind? Which is probably the most common experience when you're trying to work out what on earth is going on to me. And probably if there was a catch cry within the Charles Bonnet Syndrome community, it would be, wow, first I lost my vision, am I now losing my mind? And that's the biggest fear of all. Then another one is, am I so unraveling that now I'm going to be put into institutional care? Am I going to be put on strong medications? And I think the last one here, which is a very big issue, will I be shamed or ridiculed if I open up to others? Because people are terrified. If they're feeling that their mind's unraveling, they think if I open up and tell someone, whether it's a family member, a friend, or lo and behold, a GP or someone within the eye healthcare field, they're worried that they're going to be given a referral to psychiatry. Next slide. So given all that, this, again from that novel, graphic novel, 1,000 Coloured Castles, this really encapsulates the sort of feeling that Miriam is going through, that she's totally surrounded by black, and so there's feelings of being alone. Am I the only one going through something like this? Have I entered an eternal nightmare? And I'm in the dark, I don't know what's going on. Next slide. So what is it? So what Charles Bonnet, which we've already sort of talked about, is that there's really three things that are required as the central features of the condition. The first is that you have some form of vision impairment. And as Sapna mentioned at the beginning, it can be from any type of eye disease or any type of eye injury, or it can be where something along the visual pathways has been affected. That's the first thing. The second thing is that you are starting to have visions of various things. And the third is that your mind still remains sound. Next slide. So as has already been, so there's simple versions. Some people only get the simple, which is like geometric patterns like wallpaper or grids, cobwebs, honeycomb, things like that. The complex is the sort of, as you would imagine, like objects, buildings, flowers, faces, figures, vehicles, and even full landscapes. Next one. I think we're now going to see an example of simple. So we can really quickly go on. You see checkerboards up the top, spirals, honeycomb shapes. Next one. So if people are wanting to know, well, what's the definition? Is there a diagnostic criteria? Unfortunately, at the moment, around the world, no one's agreed upon what that diagnostic criteria are, but we've listed here the 5 central ingredients. We've already talked about the first 3, the vision loss, the repeated imagery, and that you've got, your mind's okay and you're understanding that what you see is not or cannot be real. Now, the 2 additional things that will separate it from maybe another condition that might be, that separates it from Charles Bonnet, is that there's usually your thinking and your memory remain good. And the last one is that, let's say, for example, you're seeing that figure either in the wash basin or those characters with the upturned ladders on their heads. With Charles Bonnet, it's purely visual. You will not hear them. They won't talk. You won't smell them. So none of the other senses are involved, and you won't feel them. So if you happen to be having visions and there's any other senses involved, then that might be a red flag that you're dealing with something other than Charles Bonnet. Next slide. So what's happening? Well, next slide. The person needs to understand, learn from their doctor or their health worker or some spouse or family member. They need to know, if they fulfill those requirements we just talked about, that it's not a mental illness and it's not a sign of dementia and it's not a stepping stone to dementia either. One is not losing their mind. It's a very quirky side effect of vision loss that affects, well, we're going to find out in a moment. Next slide. So how common is it? No one actually knows, but unfortunately, even still today, it's considered rare. However, if we go on to the next slide, just in the last 15 years, I've pulled out 6, but there's more than this. Here are just 6 studies done in the last 15 years with prevalence rates all between 34 and 40%, and there's even one with 63%. Now, if we leave that as an outlier, then we as a foundation are suggesting that we think somewhere between 30 to 40% of people living with some form of vision loss may go on to develop the syndrome. Next. So last year, there was a big study done in Denmark. It was the first time that anyone had ever tried through meta-analysis to work out, well, how many people in the world actually have this condition? And I think This is the editorial part from that issue, and the first sentence is very telling. It says, the number of low vision patients that suffer from visual hallucinations is, quote, shockingly large. And then if we go on to the next slide, then what was estimated in that Danish study was a global prevalence of 47.2 million people. And we believe here, the foundation, we believe that in Australia, that 300,000 people are affected by the condition. Now, that's not glaucoma specific. That is for all people who are living with sight loss. We believe it's a figure of that amount. Next slide. So yeah, if we talk, so really what we're trying to say here is that in the field of eye healthcare, this seems to be the elephant in the room. And this poor old elephant is saying, oh, no one acknowledges me. And this is really the problem, because at the moment, it is the elephant in the room. It is affecting stupendous numbers of people. And when you consider that it has a ripple effect on their loved one, their spouse, their family, their friends, the ripple effect, then we're talking humongous numbers of people who are directly or indirectly affected by this syndrome. And we believe that it needs to get a lot more serious attention than it currently is. So these are just some quick statistics about people's experience of living with the syndrome. 79%, before they started to have the symptoms, 79% said, I didn't even know it was possible that you could develop such a condition as a result of vision loss. Now, importantly, about 1/3 of people say that they find the images distressing or bothersome, and it's really affecting the quality of their life. So 1/3, it's really a horrible experience. Only 9% tell their eye specialist or GP, and that links back to what was said earlier, that people are terrified that they're going to be sent to a psychiatrist or a psychologist or the mental health route. And so that's why they're reluctant to talk, because they fear the worst. The other 2 points there is that a lot of people, and some of those viewers and listeners probably can relate to this, that they report frustration that the medical and eye health community are not always familiar with the syndrome, and that can be a source of frustration for them. And there's the anxiety because no one's screening for the condition, no one's warning them about it. So suddenly it appears, they've got nothing to go by, and they're left in their own devices and can feel completely overwhelmed by it. Here's just something that was published about a month ago. It's just showing what people living with CBS have reported. Now, this is slightly different. The two things I wanted to comment on here, I said to you that about 1/3 of all people living with the syndrome find it overwhelming. This one is suggesting many more. This is suggesting over 50% find it negative. But I think a really important point that needs to be made here is the green part to the right, that there is a minority of people. In this case, it looks like it's about 7 or 8%. Sometimes it can go up to about 15%, that there are a significant minority of people who actually love their visions. They love it. And all they want to know is, they just want the reassurance that there's nothing wrong with their mind, that they're not deteriorating up top. And once they get the reassurance that there's nothing wrong with their mind, then they feel they can enjoy the syndrome, because for some people, it's valuable on two fronts. One, it can be very pleasant and enjoyable, the visions they have of things that they've enjoyed in their life. So, for example, people who've been avid gardeners, they can often see beautiful camellias or roses and the like, and they enjoy that. The second reason a lot of people can enjoy it is because, depending on the type of sight loss, then maybe they lack the clarity and detail and vividness of everyday vision that they used to enjoy. But now with the visions, because they're often vivid, detailed, and the like, that it's sort of giving them back something from the past, if you like. Next slide. So I just wanted to quickly touch upon two common misunderstandings that are happening at the moment. Let's go with the first. The first one is, it says that you need to, there's a belief out there, even held amongst healthcare professionals, that you need to have significant vision loss to develop the syndrome. And that's just not true. So glaucoma is actually probably an excellent example of that, because we've had people say things like, we've had clients say, well, I asked my ophthalmologist, do you think I've got Charles Bonnet? And the ophthalmologist has said, well, you can't possibly have Charles Bonnet because you can read the eye chart fine. And here's a classic example with glaucoma, because visual acuity is just talking about how well can you read the eye chart, how far can you go down with the lettering, how much of that can you take in. And the thing is that it's been well documented with those examples there, but let's just focus. Here's some examples of studies showing, this is quite recent, 2 years ago, showing 3 cases of people with advanced glaucoma with a lot of field loss, but they've still got their central vision remains good. And so here's just another one that you can get the syndrome with good acuity. So let's go on to the next bit. Now, the second misunderstanding is that only eye disease can trigger CBS. Now, let's not talk about all those that are listed on the slide. Let's just talk about the last 2. So I think it's very important, before this presentation ends, that everyone in the glaucoma community is aware that there's 2 active ingredients in many prescribed eye drops for glaucoma that have been known to cause visions for decades. And one of those is timolol. That's been around a very long time now. That's been around for many decades. Timolol is a beta blocker, and brimonidine is not a beta blocker. But I've listed here 5 commonly prescribed medications for reducing intraocular eye pressure. Zalocom, Timoptol, Alphagan, Simbrinza, Combigan. Now, and in the case of Combigan, that actually contains both of those active ingredients. Doesn't mean you're more at risk, but I think it's really important. I don't want to overly alarm anyone because we're talking small numbers, but we do want people to be aware that this is a factor. If we go on to the next slide. Now, here's a study that was done on timolol back in 1987, and it's listing common side effects. And you'll see the 5th one down is hallucinations. And from that study, 11% of all people using timolol were developing hallucinations. And then if we go to the next slide, which is going forward a further 30 years to 2017, here's a study done in America where they've also found case examples of people who've developed hallucinations as a result of timolol. Next. So I think we're right near the end. How are we going for time? Because I'm worried we're going over.
I was just going to interrupt you with some questions. But would you like to finish off this slide here, and then we can go into
I think we're very
some
close
questions
to the
coming
end.
through? Yeah.
I'm happy to go either way. I can see that we're very close to the end. So if you like, I'm happy just to move to questions.
Some questions, So we had Abdul again ask if is there anything that a person can do to avoid Charles Bonnet syndrome?
Wow, that's a very good question. I don't think anyone at the moment really knows what you can do to avoid it. I think there's two things that I would say, and I think it was going to come up for the rest of the slides. One was the first port of call is, and this doesn't occur in all instances of glaucoma or other eye conditions. Sometimes it's not suitable, but if there's any opportunity for some sort of intervention, surgical or otherwise, that can improve the person's vision, then that would be your first port of call. Because if I use an example of cataracts, so we do know that if someone has Charles Bonnet and they're living with cataracts, and if they remove the cataract, sometimes, not always, sometimes there's lots of instances of it over decades. Sometimes the visions completely disappear after you've removed the cataract and the person's vision improves. So the first thing to do is there anything that is available to me that can improve my vision? Because what we do know is if there's a way to improve a person's vision, then that can sometimes resolve the visions. The second thing is making full use of services like Glaucoma Australia and other low vision service providers like Vision Australia, Guide Dogs, Visibility over in WA. Make use of all the low vision rehabilitation services that are available to you. So for example, in the case of glaucoma, if you've really got advanced field loss, then you might be having trouble where you're accidentally bumping into things or people because they're just out of your visual field. I would encourage you, if you haven't already done it, to see an orientation and mobility instructor and get new tips and clues, maybe even seeing an orthoptist or an optometrist. What really is important with Charles Bonnet is really optimizing the vision you still have left and finding ways to draw upon new ways of managing effectively in the world with the help of services like orientation and mobility instructors, orthoptists, occupational therapists and the like. Because one thing that we haven't really touched upon in this presentation is that there's the aspect of stress, and people are already often really stressed and their confidence can plummet as a result of the vision impairment and how that's affecting their everyday life in the work context, social settings and the like. So that can really hit at a person's sense of confidence, and the stress of the visions can play into that. And we know that stress can be a risk factor for increasing or perpetuating the visions. So anything that you can do that brings more feeling of self-confidence or mastery in your life, please introduce it into your life. Get all the help you need to help you with everyday activities of life and feel like you're more on top of it. And maybe get counselling about the effect that the vision loss, forget about the visions for a moment, seek out counselling for how the vision impairment has affected you. Because I think a lot of people are also not adequately, they need to find ways to work through the sense of loss and trauma of the vision impairment. Maybe they haven't had an opportunity to do that. So there's some of the things, Abdul, that I would be recommending as a way to avoid, or if it's already begun, to try and reduce.
Thank you so much, Scott. We are out of time, but your talk today has probably validated things for so many of our viewers. Can we please just get some details on how our patients or anyone watching this can get in touch with your foundation? So would there be so there you go. So it's 1-300-121-123. So thank you so much for your time this evening. We will be in touch with you with more questions because there are plenty more questions coming in. But thank you so much.
You're welcome, Sapna. The only last thing I would add is that if anyone really has burning questions for us, apart from that 1-300 number on your screen, is that you can also email us, which is just info, I-N-F-O. Oh, there it is. Thank you, Sarah. And we will definitely get back to you and assist where we can.
Thank you.